Imagine waking up tomorrow and realizing you caught prostate cancer before it had any chance to spread. Sounds unbelievable, right? But it's not. In fact, that single moment of early detection could be the reason you live 20 years longer. Now let me ask you, have you ever brushed off those little inconveniences in your body like a weak stream, a midnight bathroom trip, or a nagging ache in your back, thinking it's just age catching up with you? You're not alone. Most men do exactly that, and that's the trap. Because what feels like nothing today can quietly turn into everything tomorrow. The truth is, prostate cancer rarely announces itself with loud, obvious symptoms. It creeps in, quietly disguising itself as the normal wear and tear of getting older. And that's why so many men don't realize they're in danger until the disease has already spread, when options are limited and survival drops sharply. That's the cruel reality I've witnessed again and again in my practice. And it's why I refuse to let you ignore the warning lights your body's already flashing. I'm Dr. Edward Blake, and after decades of helping men across this country protect their health, I can tell you with certainty, the earlier you act, the more power you have. In this video, I'm going to walk you through the 7 earliest red flags your prostate may be in trouble clues that seem harmless but can be life-saving if you recognize them. And stay with me, because at the end, I'll give you a simple 1-minute test you can do at home tonight with just a watch and a glass of water, a test that could give you clarity and peace of mind immediately. So don't look away. Don't dismiss this as just another health video, because the next few minutes may be the most important investment you'll ever make in your future. Let's begin. You know what separates a simple backache from a silent red flag? It's persistence. A pulled muscle eases after rest, but prostate-related pain lingers like an unwelcome shadow. Picture this: a man in his 60s blames his constant hip and pelvic ache on yard work. Weeks turn into months, painkillers stop helping, yet he ignores it until the diagnosis arrives far too late. This is the trap most men fall into. Here's the truth. Your prostate sits at a crossroads of nerves and blood vessels. When abnormal cells grow or severe inflammation builds, pressure radiates into the lower back, hips, or thighs. It feels like arthritis, but it isn't. Studies show that men later diagnosed with prostate cancer often recall chronic pelvic pain as one of their very first warning signs. And survival rates nearly 100% when caught early, but they drop dramatically once cancer spreads beyond the prostate. That's why documenting pain patterns, time of day intensity, what makes it worse isn't paranoia, it's prevention. So if the ache in your pelvis refuses to leave, don't write it off as age. Write it down, bring it to your doctor, and demand answers. Pain is not weakness, it's data. Data that could save your life. But just recognizing this one symptom isn't enough, because there's another sign that's even more dangerous. One most men laugh off until it's too late. Let's be clear: when intimacy suddenly stops working, it's not just in your head. One of the earliest but most ignored signals of prostate trouble is sudden erectile dysfunction. Imagine a man who's always been confident, suddenly blindsided when his body fails him without warning. Embarrassed, he blames stress or age, buys pills online, and hides the problem. But beneath the surface, his prostate may be quietly cutting off the very blood flow and nerve signals that make an erection possible. Here's the science. The same tiny vessels that power your performance run directly past the prostate. When that gland swells, inflames, or develops abnormal cells, it doesn't just squeeze urine flow, it chokes circulation. Research from the American Cancer Society shows that unexplained erectile dysfunction can precede a prostate cancer diagnosis by months, sometimes years, which means ignoring it isn't just risking your sex life, it's risking your actual life. So what's the move? First, rule out the obvious culprits: medication, side effects, diabetes, alcohol. But if none fit, don't bury the truth. Track when the changes began, how sudden they were, and whether they pair with other signs like pelvic pain or nighttime urination. Then take that log to your doctor. A PSA blood test or physical exam takes minutes, but it can reveal the hidden cause before it spreads. Because ED isn't only about intimacy, it's about survival. Your body is speaking. The question is, are you listening? But just knowing this still isn't enough, because the next warning sign is even easier to dismiss, and men pay for that mistake every single night. Few sights stop a man cold like spotting blood where it doesn't belong, A splash of pink in the toilet bowl, a streak in semen, it's terrifying. But here's the mistake. Many men see it once, panic briefly, then dismiss it when it disappears. That's dangerous because blood in urine or semen is one of the clearest alarms your prostate can send. Picture this. A healthy, active grandfather notices faint discoloration one morning. He blames a long bike ride, tells no one, and assumes it's gone for good. Months later, the same symptom returns, only this time it comes with a diagnosis he can't ignore. This is how early opportunities slip away. Scientifically, the reason is simple. When the prostate becomes enlarged, inflamed, or develops abnormal tissue, fragile blood vessels break. Tiny leaks then show up in the urinary tract or reproductive fluids. Research in urology journals confirms that repeated unexplained hematuria, blood in urine, or hematospermia, blood in semen, warrants immediate testing. It doesn't always mean cancer, but when combined with other warning signs, it can be the difference between catching it early and catching it too late. So if you ever notice blood, don't wait for a second time to confirm it. Write down when you saw it. Note the color, whether it came with pain, urgency, or weak flow, and bring that record straight to your doctor. Because your first warning may also be your last chance to act in time. But only recognizing visible signs isn't enough, because the next red flag doesn't show up in the mirror. It hides deep inside your body, masquerading as something far more ordinary. Waking up once in the middle of the night to use the bathroom might seem harmless. Twice, still easy to dismiss. But when you find yourself getting up 3 or more times every single night, that's not just poor sleep, it's your prostate begging for attention. This is what doctors call nocturia, and it's one of the most common early red flags men ignore. Imagine this: a man in his late 50s thinks he's simply drinking too much water before bed. He cuts down on fluids, avoids coffee at night, yet he still wakes up, stumbling half asleep toward the bathroom again and again. He blames aging, never realizing his enlarged or inflamed prostate is pressing on the bladder, tricking it into feeling full, even when it's not. What starts as a nuisance quickly becomes a nightly ritual that chips away at rest, energy, and quality of life. Here's the science. Studies show men with untreated nocturia face higher risks of fatigue, weakened immune systems, and even dangerous nighttime falls. More importantly, this constant urgency often signals benign prostatic hyperplasia, or in some cases, the earliest stages of cancer. Ignoring it not only robs you of sleep, it delays a diagnosis that could save your life. So if you're waking up more than once a night, start tracking. Write down how many times, how much urine comes out, whether it's a sudden urge or just a dribble. That simple log can give your doctor the evidence needed to pinpoint the cause and protect your future. But nighttime urgency is just the beginning, because the next warning sign isn't about how often you go. It's about how your body feels when you can't go at all, and that hidden danger is even more alarming. If your stream used to be steady but now sputters, stops, or feels like squeezing water through a bent garden hose, that's not just aging, it's a clear warning sign from your prostate. A healthy bladder should empty in one smooth push. When the flow becomes weak or interrupted, something is standing in the way, and more often than not, it's an enlarged or inflamed prostate pressing on your urethra. Picture this: a man stands at the toilet for over a minute, straining, stopping, and starting, embarrassed when the sound is nothing but short bursts instead of a steady stream. He laughs it off, telling his friends he's just getting old, but inside his bladder is fighting against back pressure every single time. Left unchecked, that pressure weakens the bladder wall and can lead to infection, stones, or even a total urinary blockage that lands him in the emergency room. Here's the science. According to urological studies, normal bladder emptying about 8 to 12 ounces should take no longer than 20 to 30 seconds. Anything slower is a red flag. Prolonged straining signals obstruction, which could be benign prostatic hyperplasia or even early cancer. Tracking this at home isn't complicated. Simply time yourself, jot it down, and share those notes with your doctor. Data turns vague complaints into hard evidence that leads to early life-saving action. So don't ignore the drip-drop struggle. Don't normalize the stop and start. Pay attention now and you could avoid a catheter tomorrow. But even this isn't the scariest clue, because the next warning sign is one no man ever wants to see, yet it may be the most urgent of all. 1 UTI might be bad luck. 2 in the same year. That's your body waving a red flag. Recurring urinary tract infections in men are never normal, and very often they're a direct consequence of a prostate under attack. When this gland swells or grows abnormally, it blocks the flow of urine. The bladder can't fully empty, leaving stagnant urine behind, and stagnant urine is the perfect breeding ground for bacteria. Imagine a man who notices burning when he urinates cloudy or foul-smelling urine and an urge to go again minutes later. His doctor prescribes antibiotics, the symptoms fade, but within weeks they're back. What he doesn't realize is that the infection isn't the real problem, it's the blocked plumbing behind it. While he keeps treating the symptoms, the root cause silently progresses. Here's the science. Men with recurrent UTIs are significantly more likely to have underlying prostate conditions. Studies in clinical urology show that chronic infections are often linked to enlarged prostates or even early-stage cancer, disrupting normal urine flow. Ignoring these warning cycles doesn't just mean more antibiotics, it risks permanent bladder damage, kidney infections, and a delayed cancer diagnosis. So if you've had more than one UTI in a year, don't just refill the prescription. Start keeping a simple record: frequency, severity, and whether the flow feels weak or incomplete. That record can give your doctor the missing puzzle piece to uncover what's truly happening inside. But knowing about infections alone isn't enough, because the final warning sign we're about to cover isn't subtle. It's the ultimate alarm your prostate can send, and ignoring it could cost you everything. Not all pain is created equal. Muscle soreness fades, arthritis flares come and go, but persistent pelvic pain, the kind that lingers for weeks, even months, is different. It's the body's smoke alarm, and when it won't shut off, you can't afford to pull the batteries. Picture this: a man in his 60s feels a deep ache in his pelvis. He blames long hours, sitting stretches, more pops ibuprofen, but the ache stays. Weeks later, it grows sharper, radiating into his lower back and thighs. He's convinced it's just age until scans reveal the truth: his prostate has been quietly pressing on nerves and blood vessels, signaling distress all along. Here's the science. The prostate sits at the crossroads of vital pathways, nerves, lymph nodes, and blood vessels. When abnormal cells grow or severe inflammation sets in, they create pressure your brain interprets as pain. Unlike a strained muscle, this pain doesn't improve with rest, it intensifies with time. Studies show that chronic pelvic pain is one of the most frequently recalled early symptoms in men diagnosed with prostate cancer. And here's the sobering fact: survival rates are nearly 100% when caught early, but drop dramatically once pain indicates spread. So what should you do? Track the discomfort. Note how long it lasts, what triggers it, and how severe it feels on a scale from 1 to 10. Bring that record to your doctor and insist on testing. Don't mask the alarm, investigate it. Because ignoring pain today could mean losing choices tomorrow. But just identifying the 7 signs isn't the end of the story. The real power lies in knowing what to do with this knowledge. And in the closing moments, I'll show you how to turn awareness into action and fear into confidence. You've now heard the 7 earliest warning signs of prostate trouble. 7 clues that can make the difference between catching cancer early when it's nearly 100% treatable and discovering it too late when choices are fewer and harder. And here's the truth: paying attention to your body is not weakness. It's wisdom. It's strength. Every time you track a symptom, every time you ask your doctor a question, every time you refuse to shrug something off as just age, you're taking control of your future. That's powerful. That's brave. I know it can feel overwhelming. Maybe you've already noticed some of these signs. Maybe you're worried about what they mean. But remember this: you don't have to walk this road alone. Knowledge is your first shield and action is your second. By simply being here, listening and learning, you've already taken the hardest step, deciding not to ignore your health. And that decision could add years, good years, to your life. So I have a request. Save this video so you can return to it whenever you need a reminder or want to share it with someone you care about. And hit subscribe right now. By doing so, you'll stay connected to the latest medical insights, practical prevention tips, and life-saving advice on prostate health and beyond. Because the truth is, your health journey doesn't end here, it begins here. And I want to walk that journey with you. And I'll leave you with this thought: prostate cancer doesn't begin with a roar, it begins with whispers. Those whispers may sound small, but when you listen closely, they can save your life. You have the power to notice them, the courage to act, and the chance to write a healthier story, not just for yourself, but for your family, your friends, and everyone who loves you. Let's face the future together with knowledge, with strength, and with hope.